Hey guys, it's Mike from Purity Health and Wellness. I wanted to go over one exercise with you for the gluteus medius. This one's called the prisoner shuffle. Essentially, it's to activate this muscle so it protects the other muscles in your lower back and even into your quads and hamstrings, which commonly lead to things like patellofemoral arthralgia, which is a knee condition that means the knee's not tracking properly. So the way this exercise goes, we need one of these TheraBands. There's different colors depending on what we're trying to accomplish, but today we're going to go over the green one. We're going to put this TheraBand just under your kneecap. What we're going to do is we're going to have your feet 1 foot apart, toes pointing straight ahead. It's really important that you keep this 1 foot spacing. And then when we start the exercise, it's a simple 2-inch step with your left foot, a 2-inch step with your right foot. So you're always coming back to this 1 foot separation. So all this exercise is you're going to do 10 steps to the left. And then where you feel the muscle engaging is really the benefit of this exercise. A lot of people will start to feel it into their hamstrings, or their quadriceps, or their hamstring muscles, or even into the lower back. But the whole point of this exercise is that you feel it into your glute muscles, your gluteus medius in particular, which really starts from the side of the hip and goes into the back of the glute, so it wraps around this way. The whole point of it is so that you feel it in this muscle, because if you're not feeling it in this tissue, then chances are you're using accessory muscles like your quad or your lower back, like I was saying, that are engaging to try to activate to do its work. But this is the biggest muscle, so it should be the one doing the work. So to go over this exercise without kind of any interruption, 1 foot apart, toes pointing straight ahead. It should look like this, so you should have a similar pace. You're going to do 10 steps to the right in this scenario, and then when you get the 10 steps, you're going to stop, and then 10 steps to the left. Ideally, you would do this exercise 3 sets and first thing in the morning before you leave the house. Because like I said, this is not really strengthening the muscle, more than we're activating it and making sure the right muscle's activated. So I would recommend doing this exercise every single day before you leave the house, 7 days a week, and just make sure that you're feeling it in the right spot. If you're not feeling it into the glute and you're feeling it somewhere else, essentially you're doing it wrong. So what I need you to do is start to engage your glutes. So basically with this modification, you'd be clenching your glutes the entire time, squeezing the entire time, trying to feel it back and through this area. A lot of people will feel it on the sides to start, but that's just because the muscle's not engaging like we'd really like it to. So it's okay if you do it on the sides, but anywhere else you need to start firing the glutes more and really just clenching while we do this exercise. The more time goes on, the more natural it will be to feel it in the right spot. But again, it's just figuring things out at home a lot of times so that we actually can trigger and control that muscle when we need to.